Big news, and foreign dentists are set to be allowed to work in the UK without taking a qualification exam. Ministers are planning to scrap the overseas entrance exam currently required to allow dentists from non-European countries to work in Britain. The Dentists' Union has criticised the new plan, however, accusing the government of trying to fill a leaky bucket without addressing the real issues. So, with 4 in 5 dental practices not accepting new patients, is this a smart way of eliminating red tape and getting people seen, or does it risk cowboy operators endangering patient safety? Well, to discuss this, I'm delighted to welcome dentist to the stars and king of celebrity smiles, renowned Harley Street dentist, Dr. Richard Marks. Dr. Richard, thank you so much for joining us.
Thank you.
First of all, does this entrance exam matter? Is it important?
It is important. The entrance exam is relatively rigorous, and it's a way of kind of standardising anybody who comes in with a degree from another country, and for them to have something that basically makes sure that they have all the skills needed to actually practice dentistry in the UK.
OK, well, I'm glad to hear it's rigorous. Do you think that we can afford not to have it?
The worry is that whether the standards of the training in all the different countries are up to the standards that they can just come in and start practicing straight away. So that there is a worry with that, you know, and sometimes there's perhaps shorter courses, or perhaps there's ways that people have not been trained perhaps at a level that they might have in the UK. That's the worry.
I mean, the government has said that they want to get rid of red tape, which allows dentists who are very fully qualified abroad to come and do their work here. And let's be honest, we need the dentists. Is this not a national emergency?
Well, that's one thing. We do need the dentists. There is a shortage of dentists. So there definitely is an argument for it in that, from that point of view. But it really is a question, is it safe? That's the question.
Yes, of course, that is the question. Are overseas dentists any good?
I mean, what we say is there's good dentists and bad dentists everywhere. So
here and abroad.
Here and abroad. So, but we would say that the training in the UK, you know, I trained in this university, King's College London in UK, and it's quite a difficult training. It's quite stringent, you know, put you through a lot. So you know that you've kind of come out the other end and are ready to practice.
I mean, are there countries where the testing seems a little lax? Because surely not every country has the same high standards that we do.
It's hard to standardise, that's the main thing.
And that's the point of the exam?
Exactly, that's the point of the exam.
I mean, are there overseas dentists that you wouldn't take if you thought, well, I'm not that happy with how Turkey do it, or Romania, or anywhere else?
I think there's also different teaching. So here, you know, what they really want to teach is restoring teeth, saving teeth, preventative dentistry, trying to concentrate on those things. And maybe there's different teachings from other countries. Maybe they're using different materials that we don't have. Right. So it's kind of that standardisation that's really important.
Well, indeed, and dentists have different philosophies, don't they? And some are really big on extraction or doing extraction fillings, that sort of thing. Others would, you know, are a little bit less hands-on and a bit less, I don't know, sort of direct in how they would treat a patient.
Definitely, and kind of treating patients of all different ages, that's really important. How the system actually works, if you're working as part of the NHS system, and how dentistry is done, all of those things, you know. Also, like the systems of charting that we use the different systems of charting and measurements for the gums, so all of those things have to be taught.
And why, Richard, don't we have enough dentists in this country?
Well, the thing is, there are qualifying, you know, quite a few dentists, there's quite a few dental universities, but I think it's just that there's such a demand. It's such a huge demand. And there's the dental health of the population. Also, there's an ageing population.
Right.
You know, they need to be looked after. Sugar intake, that's another thing.
So are our teeth worse than they were perhaps 20 years ago?
I don't know if they're worse, but they definitely, you know, there's a lot of problems. I don't know if you've seen that one of the main admissions for hospital is kids for general anaesthetic having their teeth extracted, which we shouldn't really be in that.
That's a tragedy, isn't it?
It's really awful, and we shouldn't really be in that situation at the moment in this day and age,
If you were the Health Secretary, would you have an overhaul of how dentistry is done in this country? Does it need a rethink?
It definitely needs something drastic. It's one of the biggest problems that's reported to MPs and reported in people's local area, that they're really struggling to find a dentist. So I think it needs a lot of attention. It needs dedicated funding, more training, more education, perhaps more dental universities.
Does the divide between private and NHS work, is that well calibrated?
The thing is that everyone needs some care. That's the really important thing. So, I would say, everybody believes in the NHS, across the board. So, in NHS dentistry is really important. You don't want people in pain, people with toothache, people with cavities, they can't eat properly, they can't smile.
Well, there you go. Well, listen, it's fascinating to have you here. I won't ask you to check my molars. All I will tell you is that knowing you were coming in today, I flossed this morning.
Very good, well done.
Enjoy it while it lasts. You're, of course, from Dr. Richard Clinics, which is your organisation, and my thanks, therefore, to the dentist to the stars, the king of celebrity smiles, renowned Harley Street dentist, Dr. Richard Marks.